Welcome back to Design and Thrive Studio. We have a podcast. In this episode, we have Robert Granger from Nautical Health as our guest today. Welcome, Robert.
How you doing, man?
Doing awesome. Thank you. Thank you for asking. Well, let's get to it. So, what inspired the name of Nautical Health? Is there a story behind it?
It is actually. So when I was 3 years old, I was a kid that loved boats. And so I snuck out of the house one time and walked out to a dock while my parents were asleep. By the way, I snuck out through a doggy door. And ever since then, I've been obsessed with boats. I used to collect them whenever I would visit islands in the Caribbean. So when I started my company, I knew it had to be something that had a sailboat as a logo. So that's basically how Nautical Health was born.
Perfect. So, as a kid, you're probably wondering, how am I going to apply this in my future? And now you have Nautical Health.
Right. I thought I was going to go into the Navy, and my dad was like, I don't know if that's a good idea for you. But, it still presented itself. I have a boat as a logo, and I go on cruises a lot. So that's enough for me.
Awesome. Well, for listeners unfamiliar with Nautical Health, how would you describe your core mission and services?
So basically, our core mission is to help hospitals, primary care groups, as well as health plans achieve value based care through strategic planning, training, and technology.
So how have you adapted your value-based care approach over the last 15 years?
The interesting part is that I started my business only 2 years after the Affordable Care Act got signed. So the first 5 years, it was all about learning how healthcare was going to change or rather evolve slowly based on the Affordable Care Act and also how the private industries would adjust to it. So adapting for me basically meant building relationships with health plans, with primary care groups, as well as individuals in the federal workspace so that I could be kept abreast on how these changes were going to impact patients, impact the provider experience and workflow, as well as impact reimbursement, which is what the key driver for a consultant would be.
Okay, so you offer programs like internships, clinical rotations, and residency placements too. How do those fit into your bigger vision?
The big vision is that healthcare, as we expand and more people have access to health insurance, we're going to need more providers, and we're going to need more providers from all walks of life. In addition to that, we're going to need more pharmacists, more nurses, more certified medical assistants. And so, me being able to offer internships is my way of making sure that we ensure that we have that pipeline for our future providers to come along. One of the things that we don't talk about as much in healthcare is that there is a such thing as burnout for medical providers. And so we need to be embracing not only this new generation of medical providers and their training experience, but also teaching them value based care. Traditionally, medical providers that went to medical school or pharmacy school, they don't tend to learn health administration, they learn clinical practice. And now you have to have both in order to thrive in the industry. And so that's my way of giving back to the next generation by offering internships. And by the way, my interns vary from health educators to doctors to pharmacists.
Wow, that's an amazing group of people there.
Yeah, it's really awesome. And I love to see the intercollaboration of the different disciplines as well.
Mhm. Okay. So how do your student programs help address health disparities in diverse communities?
That's a really good question. One of the ways that we do it is that we utilize the need for students to have practice experiences in order to graduate to merge them into social determinants of health programs. Rather that be identifying tools and resources for low income patients to utilize or by using technology to figure out different ways to engage these patient populations as well. But the great and exciting part about it is that health disparities and social determinants of health, as it became more popular during the Biden administration, has really set off a lot of new medical providers and students to have passions in this area. So everyone wants to have at least one experience of doing this before they get out and start practicing in the real world.
Definitely. Well, practice makes perfection, right?
It does, and it adds some passion to it.
Awesome. So, what hurdles do international students face, and how does the program help?
That's something that we're still kind of working on. And international students have a lot of barriers. The first one, of course, is to make sure that they have the appropriate student visas to come to the United States. So that is the initial hurdle. But then the other one is cultural things. The US health system is unlike any other health system in the world. And so being able to understand the silos that exist from hospital systems to how providers in the primary care space practice different specialists, and then also looking at it from the perspective of how health insurance plays such a huge role depending on the type of insurance that they have. These are learning barriers that a lot of these students face. And so, one of the things that we do to get over that hurdle is to start early by offering training as well as different practice experiences that they can do virtually prior to applying for their visas and prior to coming over here and engaging with American healthcare professionals.
Okay. And you talk about hurdles. What are some of the biggest challenges you face in delivering or scaling your programs?
Oh, that's a good question. I would honestly say evolving to the specific needs of each individual client. Every healthcare organization has a different journey of why they're practicing and what challenges they're facing. And oftentimes we consultants don't get the full story. And so getting in and making the time to understand the full story, making sure that we understand what key decisions kind of led to this point, as well as to understand where they're going, is the way to make sure that there's a nice synchronization between the services that we bring and the services that the organizations are offering.
Okay. So, Robert, how do you measure success, whether that's in outcomes like reducing hospital visits or improving cost efficiency?
There are two different buckets of success for me. The first bucket of success is obviously those numerical things like reducing hospital visits. My company has been one that has reduced hospital visits for organizations as great as 20%. So those are important, but it's also about the narrative of how did we improve access to healthcare in that particular geographic location. And sometimes it's not about numbers, it's about something as simple as making sure that medical assistants can see as many patients as possible and have positive patient engagement experiences while they're doing it.
So, what strategies have worked best in cutting ER visits and hospital admissions?
I'm a firm believer of care coordination and using bill codes like for care management as well as transitional care management. These are still bill codes that are not used universally throughout the US healthcare system. But when using those and hiring care coordinators and other individuals to do this body of work, it's going to increase patient education, engagement, and identify patient risks before some of these problems would cause them to have to go to the ED or to the hospital to be admitted. So, building on this through technology like population health tools is a key way to reduce unnecessary ER utilization in hospitals.
Okay, perfect. And with all the buzz around AI in healthcare, how are you thinking about incorporating into what you do, or are you currently using it?
I always think about AI in terms of how we can inform and modify workflows. A lot of times, what most healthcare professionals, particularly those that are not physicians, struggle with is what do I need to do? What patient do I need to see first? And how do I manage these tasks? What AI can do is take patient level data and merge it with workflows that we've designed to then create prompts. So a nurse is basically looking at these prompts and saying, I need to call Mr. Henry back and make sure that he gets his prescription filled because the pharmacy is about to close. And then I can call Miss Sue back later because I just want to remind her of her appointment. So that is how AI is basically helping me in the practice transformation and value based care sector. But every sector is going to be different in terms of how they use it. And I just caution every individual to think about the end user impacts, not just the top level decisions, but how your actual employees are going to benefit or not benefit from AI.
Okay. And as AI grows, how do you see care coordinators and health coaches evolving?
I believe that it's going to empower them to see more patients. One of the burdens of these types of departments now is in a given day, you really can only see about 10 patients because you have to take the time to thoroughly review their charts, gather information, talk to the doctor. But AI is going to be able to synchronize a lot of this work so that upon logging on into one patient chart, you're going to be able to see a longitudinal record of this information, which gets you engaging that patient quicker and gets you off the phone quicker.
I like that you use the word longitudinal.
Right. I mean, but it's a big thing. I mean, right now through Cerner has a product that Cerner slash Oracle has a product that they're using with the Department of Defense and the VA, and they are actually implementing a longitudinal record now that I was blessed to be a part of the initial phases of that.
Awesome. So, Robert, what's your 5-year vision for nautical health and what does success look like?
My 5-year vision is to expand internationally. I want to be a part of think tanks in Middle Eastern countries, in particular, that are really using technology to modernize their healthcare system. And already they are looking at organizations like the NCQA for looking at their steps for developing out patient centered medical home and how to actually develop that type of work in these countries. So I want to be a part of that. I want to be a part of sharing the successes and the failures that I've saw from the primary care perspective in general, because we know that if you make sure that the delivery of primary care goes well, all of the healthcare system will fall into place.
And finally, for anyone who wants to learn more or partner with you, what's the best way to get in touch?
You can email us at info@asknauticalhealth.com or visit our website at www.asknauticalhealth.com.
Perfect. That brings it that brings it close to our show. Design and Thrive. We had an amazing time with Robert. Thank you, Robert.
Thank you so much.